Checkup by BOQ Specialist, a series of podcasts created specifically for current and future doctors, dentists and vets.
Recent Australian research shows that doctors in training who work more than 55 hours each week have double the risk of developing mental health problems and suicidal ideation. Double the risk. That's something worth talking more about. I'm Sarah Watson, Student and Grad Marketing Manager at BOQ Specialist, and I'm really keen to learn a bit more about the factors contributing to this figure and what can be done to address and reduce it. Are those who are caring for others being cared for themselves? That's what we're here to discuss today, and I'm thrilled to delve deeper into the discussion with our guests, Peter Peters, New South Wales Student and Grad Banker here at BOQ Specialist, and Mr Luke Lindsay, General Manager of Lifeline Queensland. Luke is an experienced health and human services leader with over 20 years' experience in clinical and academic leadership and management roles within the health sector. Luke has a strong passion for mental health with a key focus on building a mentally healthy community. We couldn't think of a more appropriate and highly qualified guest to have here with us today to discuss the current issues facing medical students and junior doctors in today's world. So welcome, Luke. Perhaps you could start by, letting us know a little bit of background about your career in the mental health sector.
Absolutely, Sarah. So I'm actually a mental health nurse, and I have worked primarily in the mental health sector for the last 20 years. Initially, I worked in public mental health services, in hospitals and community mental health settings, and in academia for a little while in the university space, and I've done quite a bit of private clinical practice as well. But at the moment, I am working as a general manager with Lifeline Queensland, and really with a strong focus on suicide prevention and community resilience building.
So I guess in your line of work there, you would probably be more than aware of these statistics that there's double the risk of developing mental health problems and suicidal ideation within the medical student and junior doctor cohort.
Absolutely. And look, there's significant factors that predispose medical students and any kind of medical or health professionals, but in particular medical students and junior doctors, to mentally ill health and to suicide. And look, I think it's important that we also put out there that the conversation around mental health and the conversation around suicide can be really confronting and incredibly triggering for some people. And I think particularly for anybody listening to the podcast, it's important at this point to stop and think, are you in a good position today in terms of your own mental well-being and health to actually listen to this podcast initially? Or do you need to come back and check in at another time when you're feeling up to it? And really to listen to your gut before we go on to start to talk about some of these, what can be very triggering and confronting conversations. And I guess the importance of knowing that we can contact Lifeline on 13 11 14 should anything discussed in the podcast be triggering or distressing for you. So look, when we think about medical students in particular, and we think about some of the predisposing factors, particularly those stress factors or precipitants for mental distress or mental illness, there are some of those factors that start very early on in their study life, very early on in their career. And often what we see is during the university days, we start to see high pressure study regimes and really increasing demands in terms of their time, and trying to find that time to build in study and to build in all the other elements of training required. So time, sleep, appetite, diet, those kind of things are really key factors, not only for medical students, for everyone, but in particular for medical students that have significant pressure around competing demands and around study schedules. And often what we find with students is that things like sleep and good quality sleep, things like what we call sleep hygiene, so having a regular sleep pattern, and diet are really important, but they're things that are often overlooked. So we talk about the triad, which is really important. So exercise, physical exercise, diet, and sleep. So those three factors are really important, particularly within the medical student cohort, because without those three, even in the absence of study stress, we see a significant impact on people's well-being, their capacity and ability to function, and that direct impact on their well-being. I think when you balance that against the pressures not only of the rigorous study schedule, but also the pressure around academic performance, because we know within the medical student cohort that academic performance is a competitive landscape. So it's a competitive landscape in terms of the universities they get into, and then the clinical placements they get into, and then the hospitals and the residencies and internships that they apply for is very heavily focused on academic expectations and academic outputs. And the pressure associated with that, on top of the rigorous study schedule, on top of what often is poor sleep, poor diet, and minimal physical exercise, really, they are very, very strong contributing factors to what we call a high risk mental state. So, somebody who is in a position where they may not necessarily develop mental illness, but they may develop behaviours and symptoms that place them at high risk of developing mental illness. And we know that things like anxiety and depression are probably the greatest number of diagnoses we see in the medical student cohort. And again, back to the absence of work-life balance. So it is very easy to get so caught up in the pressures around performing academically, around keeping up with your peers in terms of study regimes, in terms of trying to perform at such a high level, that all of a sudden that work-life balance disappears. So what you may have been doing historically, you may have been going to the gym, exercising, strong focus on your diet, those things start to drop off. And the study component tends to take over. And what we often see with that is a deteriorating mental state that happens slowly over time. It's quite pervasive in its nature. And we get often to the point where we start to see students, their behaviours, I guess, and what their friends and their family and their peers start to see are a change in personality, are a change in behaviours. They start to withdraw from social connection and social contact. And then if we throw other factors in on top of that, like financial stress, like not being able to work a part-time or a casual job because of the demands of study, financial stress, we know, can have one of the most significant impacts in somebody's stress levels. And those stress levels will then often lead into behaviours that we would suggest kind of meet what we would refer to as a threshold from a symptom perspective in terms of developing an anxiety or a depressive disorder.
Pete, I guess you work with medical students every day. They're your client base, and junior doctors, you would see firsthand these kind of stresses that they'd be facing,
Totally.
wouldn't you?
So, yeah, I solely see these students and interns come to me for financial assistance, and it's great to help them out with that. And that's due to the fact that they have a lot of challenges when it comes to final year, their final year of study, because they have additional expenses. They need to relocate. They need to sort of manage their life from that perspective. So on one hand, it's good to help them out in that respect, but also, like, it must be tough with the challenges that they do face. And I was also thinking, with regards to going back to what I was saying about relocating, being away from family and friends and your support structure. Luke, what coping mechanisms would you suggest when they're in that already difficult position of trying to complete their studies, being away from family and friends?
Yeah, absolutely. It's a really good point. Look, often we see students that have had to relocate, and there is that kind of loss of connection, whether it be with family or friends or people they used to connect with. I think if COVID's taught us anything, it's taught us the importance of connection, and it's taught us the importance of that virtual connection. And I think what we would suggest when we're thinking about early intervention, or we're thinking about self-care or putting things in place to really help us, let's make sure we build time around our sleep patterns and our diet and our exercise, but let's also make sure we've got time to connect, with friends and family. And I think for those students that have had to relocate, and for those students that have been separated from friends and family, important things like, virtual connection with Skype or Zoom or FaceTime or whatever it may be, building that into your week and building that into the pattern of your week is important, because, we know there's a lot of evidence and a lot of studies around the kind of the biochemistry that comes with social connection. And we know that if we can build some social connection in, and even if that is a virtual social connection throughout the week, it can be really, really important in terms of students feeling as though they haven't lost that sense of social connection.
And I guess, from a medical student point of view, that's all so relevant at that point. But then they step into a whole world of unknown, becoming junior doctors and into the hospital setting. And, while they're actually getting an income now, so the financial stresses may be a little bit less, there are a whole nother realm of stresses that are prevalent in their lives as junior doctors and the stresses within the hospital system.
Yeah, absolutely. And look, I think it's a really good point you raised, because you're right. There would be the perception that as a medical student finishes their undergrad and they step into their first residency or intern position, that you would think the pressure of the financial stress actually reduces. But in fact, often that's not the case for many students or for many junior doctors. They've stepped into the space whereby all of a sudden they have significant student debt that they're required to pay. Or all of a sudden, what may have been a HECS or a PALS debt that wasn't at the forefront of their mind, it is now in the forefront of their mind because they're required to start repaying some of those debts. So that financial stress can, for some junior doctors, be just as, if not more significant than it is for medical students. I know here through Lifeline, through Uniting Care Queensland, often a lot of the calls we get through our National Debt Helpline or through our financial counselling services are junior health professionals that all of a sudden have a mountain of debt that they need to start paying off. And they're in a position where they are starting to earn a wage, which is fantastic, but they also have to start to learn to budget their way through that debt and to reduce that financial stress on an everyday basis. But look, the other thing from a junior doctor perspective is, look, the reality is they are a high-risk group. They are a high-risk group for a number of reasons. Now, when we think about junior doctors, the first thing we think about is it is a very hierarchical system within a hospital setting. They are required to work long hours. The stepping in to the healthcare system, particularly the public healthcare system, and having to navigate that system is incredibly complex. So having to learn the hierarchy, having to learn a new hospital system, having to learn to work with a whole range of new colleagues and peers, that in itself can be really quite stressful. Now, again, just like the university student system, the internship and the hospital system can be stressful in terms of that competitive environment again, that need to want to outperform your peers and your colleagues, particularly if you have chosen to focus on a specialty that is a competitive specialty. Let's take, for example, you may want to choose, a surgical specialty with a view to advancing into becoming a surgeon. We know that's a competitive area to step into, and the pressure around performing well and around doing those long hours and, trying to outperform your peers, that in itself can be incredibly stressful and complex. There is often a culture within that hierarchy where some junior doctors will report workplace kind of stress and harassment and bullying. And we know that in itself can have a huge impact on things like developing a depressive disorder or an anxiety disorder. And at times, when that goes untreated or the junior doctor doesn't actually reach out for help, that can lead into experiencing suicidal thoughts or suicidal ideation, or in some cases even making attempts at suicide. Now, there are a number of things that contribute to that, and obviously it's not just the workplace, but often it's the combination of that workplace pressure, the long hours, the lack of sleep, the focus on having to outperform your peers, or that perception of having to outperform your peers, the financial stressors associated, that lack of social connection. The combination of all of those factors really does place our junior doctor cohort at high risk of developing mentally ill health and at times of also developing suicidal thoughts. And we know, there's strong evidence that suggests young doctors and female junior doctors are the highest risk cohort amongst our junior medical colleagues.
Yeah, there's a huge amount of factors contributing that, you've just mentioned, and they're all highly relevant. I would imagine that dealing with patients and the stresses of actual patients dealing with death on a daily basis and having to advise loved ones that their family member has passed away, all of those kind of things, that must really contribute quite heavily on the shoulders of junior doctors who aren't as experienced in that sort of scenario, I suppose.
Yeah, absolutely. And look, I think too, there is often a perception that doctors in general just take everything on their shoulders and just kind of get on with it. But the reality is, our doctors and our junior doctors are human, and they experience the same range of emotions that we experience. And often, dealing with and supporting and managing patients on a day-to-day basis is anxiety provoking, and it's complex. We have a significantly complex range of patients in a hospital setting, right through from patients that are excited to be in hospital because they're delivering their first child, or their first child is due to be born, or they are waiting on elective surgery that they've been waiting on for some time, and they're really excited to have this surgery done, right through to the other end of the spectrum, the palliative care end, where patients are coming into hospital with the full awareness that they won't be leaving hospital as such, that they'll either be end of life care, or they'll be moving into residential aged care, or they're there because it is the worst day of their life. They're there in crisis, or they're there with their own mental health issues. And so the range on that spectrum of patients that our junior doctors have to deal with every day, it really is varied, and it can vary from patient to patient. And so the skill set you need in terms of your communication skill set and your empathy and your compassion and the way in which you explain situations to patients and the approach you take to patients, depending on whether they want to be in hospital or they don't, it's really incredibly varied. And some of those conversations and interactions are incredibly anxiety provoking. How do you tell a family of a loved one that they're most likely going to pass away? How do you talk to a mental health patient who is there in crisis? It is the worst day they've ever experienced. And then your next patient may be, a patient who's just delivered their first child and is over the moon. So that range of emotions, that emotional roller coaster that you experience on a shift to shift basis, often with minimal sleep, often feeling stressed yourself, but having to be completely professional in terms of the way you interact and engage and present as very confident and give the patient that sense of calm, that and confidence in you and your ability as a doctor. That can be, and the pressure associated with that can be incredibly daunting. And if you're doing that day in, day out throughout your first year, for example, as a junior doctor, that's exhausting. It's really exhausting. And so the importance of self-care in that space and the importance of really balancing that against looking after yourself is vital.
Absolutely. I mean, most of us can step away from our work day and close the office door and go home and sort of, for the most part, switch off from the work day and get on. But I imagine that's somewhat harder when you have had that roller coaster of emotion that you've just discussed and been exposed to the situations that they are. And I mean, particularly for doctors, they're a certain type of personality, right? It takes a certain person to want to become a doctor and go into that. And do you think that the type of personality makes a difference, makes them a little bit more susceptible perhaps?
Look, I do to a degree. Look, you're absolutely right. There are a number of contributing factors when we think about mental illness and mental ill health, and whether they be social contributing factors, environmental, psychological, biological. But if we think about a personality structure or somebody's personality type, yes, there are some personality types that are higher risk of developing psychological or mental ill health. Now, certainly, I think in general, yes, we can say that students who choose medicine as a career can at times often fall within that kind of perfectionistic type personality, where they are high achievers and they have high expectations of themselves. Now, that cohort of people in our community, often the pressure they place on themselves and the expectations they have of themselves will contribute to a sense of failure if those expectations are not met. And now that can place someone at high risk again of developing an anxiety or a depressive illness. But the other primary contributing factor, really, if we think about general stress factors for medical students and junior doctors, really is around stigma. And that's not unique just to the medical profession. It is probably more significant, but the idea and the role of stigma within our society and community is really significant, and is probably one of the biggest barriers for our society in reaching out and asking for help. Now, I think within the sector over many years, we've done a lot of work around stigma reduction. And I think we have been really successful and made some significant inroads and gains in that space. However, there is still significant stigma in the medical profession around seeking help. There is persistent stigmatisation, and a lot of that really sits in that perception of competence with doctors who self-report or put their hand up to say they're experiencing or suffering with mental health problems. Now, the fact is that there are a significant amount of doctors who feel that colleagues will judge them, who will fear that there's a perception they are less competent than their peers, or that feel embarrassed about putting their hand up to say, I'm struggling and I need some help. Now, whether that's through embarrassment, whether that's through the fear of failure, whether that's through a fear of progression in their chosen career, all of those factors contribute to the notion of stigma in our medical workforce, particularly with our junior doctors. And it is probably the biggest barrier or the biggest challenge to actually seeking help. And we know that early intervention is the key. So when people start to experience symptoms or start to feel different, the earlier they reach out for help, the more likely they are to get that help and for those symptoms to be resolved and get the support they need quickly. But it is definitely one of the biggest challenges we face, is reaching out and asking for help.
And do you think that there are enough systems in place within the educational system, but more importantly, I suppose, the hospital level, to support doctors facing these mental health challenges or issues? Or would you say that's something that really needs to be worked on a bit more holistically?
Look, absolutely. I think it does need to be worked on. I think historically my answer would have been no. I don't think historically there has been enough support and enough focus and energy around the mental health and the psychological well-being of our doctors. I think that is slowly changing. I think we are starting to see that slowly change. And I think we're starting to see some dedicated supports put in place through our industry professional bodies. And I think we are in a position now that if any of our doctors jumped on and Googled, mental health support for doctors, they would be able to find something that they could access to get that support. And certainly from a Lifeline perspective, reaching out through our 13 11 14 or through our text or online chat. And one of the benefits of Lifeline is that it is a completely confidential, anonymous service. So often one of those challenges around stigma is that perception of what will people think of me if I reach out for help, balanced against, but I really feel like I need help. Now, the idea of somewhere like Lifeline, which is confidential and is anonymous, and the individual can still seek that support, is a key into actually really promoting that support. But I do think we are moving toward a system whereby the pressures and the associated kind of environmental and organisational risk factors that we've discussed are now being recognised more often. I think we're starting to see more awareness in general within the medical profession of the mental health and wellbeing of our doctors, both at a university level and in the hospital setting. I certainly think we've still got a long way to go, but we are slowly getting there.
Yeah, and I mean, it seems there's even sort of a bit of governmental focus on it too. I know that there was a national framework launched back in October, which was part of a national commitment to prioritise mental health and wellbeing of Australian doctors and medical students. So, as you've said, it does feel as though there might be a few things, broader things, being put into place to help assist and support.
Absolutely. And look, I think the Every Doctor, Every Setting national framework, which I would strongly encourage doctors to have a look at. There's some fantastic resources in that space, but I'd also actually encourage organisations to have a look at that, because it is a great way of looking how you can build organisational capacity to actually support the mental health of your medical workforce. I guess the other one really to mention is that the Doctors for Doctors State and Territory support service, similar to Lifeline, is a confidential service and something that you can reach out on a state-by-state basis in terms of accessing support. But I think we also need to think about, yes, some of the factors associated with our medical workforce and our doctors are unique to the profession and to this cohort, but is also in keeping with the general community sense in terms of supports available. So other supports such as Lifeline, Beyond Blue, those kinds of support services are always available. And often we find, particularly here at Lifeline, that people that reach out to us, it is purely for that confidential, anonymous component of the services and the support we provide, is that people that still fear stigma, they still fear a perception of how they may be judged or perceived by their peers or their family or their friends or their colleagues. But being able to seek support in an anonymous and confidential way is something that really breaks down that barrier around stigma. And I guess the other component is that often people assume they can only reach out for help when they're in crisis. Now, Lifeline, for example, yes, we are a crisis and suicide prevention and intervention service, but also, we provide a service to people that call as an early intervention approach as well. So if people are starting to struggle, if they're wanting to ask some questions, if they're wanting to see what services and supports are out there and what may be appropriate for them, absolutely, using Lifeline is a fantastic way of starting the ball rolling and using that small window of opportunity to reach out and start the process. And often we get feedback from people to say that initial call has really broken down some of those barriers and challenges around stigma, and they feel after a good and a positive experience that they're then ready to take the next step, which may be for some face-to-face intervention or counselling. It may be going to see their supportive GP. It may be actually accessing face-to-face clinical services to help provide them with the support they need.
Which is so great to have that resource there, and that's an approachable resource. And as you said, it's highly confidential. It's a shame that a lot of people feel they can only reach out at that last point. But when there's such a stigma around it, they can't speak to other people beforehand. And that's, I suppose, why it gets to that crunch point when they actually need to take action.
Yep.
Yeah.
And look, there's a few kind of tips, if I can, I think it's really important to share around really maintaining your mental health and maintaining your emotional health. And one of those really is around having a good GP. And I know the idea of a doctor having a doctor seems odd, but having a good GP that you've got a solid relationship with, that you can speak to openly, because one, they will understand the process of what you're going through and your unique experience as a medical practitioner. And they are in a position where they can actually provide some of that support for you. I mean, some of the other tips I have really is around the idea of self-care and leave. So take your leave and plan it regularly. So doctors get leave. Believe it or not, they don't work 24/7, 365 days a year. They get leave. But often there's a perception that if they take leave, they look as though they're not coping. But it is so important from a self-care perspective to regularly plan your leave. Break it up throughout the year and take it every year. Take your leave so you can have some time to yourself to reconnect and refresh, and to really have a life outside of medicine, because medicine can be all-encompassing, and it is so important to really have a life outside of medicine. I guess the other couple of quick ones, Sarah, is often we hear from junior doctors and from medical students the importance of having a mentor. So a professional mentor that you trust and that you respect, and often within any kind of junior doctor system, there is a process where you have a supervisor as such, but they are usually someone that supervises your performance on a day-to-day basis. Having a mentor is someone that you can bounce some ideas off, you can talk about challenging cases with, and you can get some general advice on. So try to find a mentor that you trust and that you respect, and that use your mentor as part of your overarching kind of support network. Again, really regular sleep, exercise, diet, and taking some time out for social connection and having that work-life balance is important, and building that into your week every week so it becomes a regular focus is incredibly important.
I find it fascinating how simple that three-pronged approach is. The thing that I can sometimes relate to is one affecting the other, where, you don't have time to exercise because you're too busy with study or work, and then your diet is affected, and then suddenly sleep is affected, and those can all topple each other quite quickly. Are there ways to ensure that doesn't happen? Is it literally just putting in your calendar that I need to do this or that at certain times of the day?
Yeah. And look, often what we find is medical students and junior doctors are incredibly organised.
Yep.
So they tend to be able to structure their days and their weeks really, really well. And so what we say is when you are structuring your week, structure your week to include these things as well. So most medical students will have their study schedule structured across their whole week. Most junior doctors will have, their week structured very well. But just as important as attending the tutorials and lectures and clinical placements are, is also structuring time in so it becomes your bread and butter, so it becomes the norm. Now, whether that be that you set your alarm 20 minutes early to get up in the morning and you go for a walk around the block, come home and have a good breakfast as a way to start, is a key. Some people, it's the opposite. They will exercise of an evening so that they sleep well, and they'll make sure that their evening meal is always something that is pre-prepared, or that, and we're in an environment now where there's all of these quick and easy, pre-prepared meals where people can not have to be overwhelmed by the thought of, what am I going to cook? Going to the supermarket, purchasing the ingredients, coming home, finding time to then cook it, eat it, and then do the cleanup. That whole process for someone who is trying to cram 12 hours of work or study into an 8-hour day can be incredibly difficult. And then often what we see is they do that, but they do that in the absence of sleep. They'll then cut 2 or 3 hours off their sleep to try and squeeze those things in. So don't overcommit. Maybe start with 1 or 2 of the things, and maybe start with exercise and sleep, and then slowly build diet in. Or start with, sleep and diet, and then slowly build exercise in. And exercise can be as simple as taking the stairs at work instead of the elevator to get to the 4th floor surgical unit. It doesn't have to be overly complex, because often time and the competing demands, time becomes the overwhelming issue. So really it's around structuring it into your week, starting small, and then building on it from there.
I think you also made a good point that everybody's different. It's about knowing yourself and knowing what works for you.
You're right, because for some people, it may be a 5K run at the end of the day. For other people, it may be as simple as parking 3 blocks away from where they normally do to get that extra 5 or 10 minutes of walk in on the way to work. It can be very individual and very specific to your circumstances.
Yeah, totally.
And look, one of the other things that we haven't touched on, but I will touch on briefly, is earlier we spoke about some of the stress and some of the anxiety around the different types of patients that doctors have to manage. Now, often doctors are involved in really significant and stressful events every day, whether that be an emergency resuscitation, whether that be an unexpected incident that occurs. It's really important to debrief after those kind of incidents and events, so that the vicarious trauma, which can be pervasive and build up over time, doesn't build up, that we cut it off in its tracks. And the idea of debriefing and talking through the incident with colleagues is incredibly important at avoiding the build-up of what we would call vicarious trauma. All those little incidents that build up, that we don't address, that we don't discuss, that we try and push away, eventually building up over time, and again, being a really high-risk contributing factor to a decline in our mental health.
And could that even be quite a subconscious thing, Luke, that it builds up over and over and they're not really realising how much each small or large even event is building up?
Absolutely. And that is the core of vicarious trauma. All of these little incidents, these little unexpected things build up over time. And at the time, they seem minor and they seem like, I've got 10 other patients to see and I need to just get on with my day. Now, when that happens day on day, week on week, month on month, year on year, those tiny little pieces of the puzzle build and build and build and build and build. And all of a sudden, we have people that start to experience symptoms like panic. They're racing heart. They constantly feel nauseous. They can't sleep. They've got racing thoughts when they go to bed. They feel this persistent low mood, easily triggered, tearfulness, easily irritable. All of those kind of things build up. When we unpack that and we work through that with them and we backtrack and we go back, often we find that all of these little events are pervasive. They add up and they start to weigh down the individual more and more and more, to the point where we start to see symptoms that would be suggestive of a clinical illness like depression or anxiety. Now, one of the keys to avoid that is a debrief, and is around dealing with the incident at the time, regardless of how trivial you think it is. And in the absence of that perception of, I'm weak if I want to talk about this, or I'm not coping if I actually want to engage in debriefing around this process.
Yeah, and I mean, like, it's not all doom and gloom from day to day in their lives. And so I guess whether they think that something's relevant to talk about or not, it probably is just good, as you said, to debrief with your colleagues.
Absolutely. And it doesn't have to be a formal process. It could be a catch up over coffee at lunch. It can be a chat on the way home from work. It can be as informal as formal as you like, but the key is actually doing it.
Yeah.
And doing it in a way that you feel comfortable and the way you feel supported.
And I suppose, in the same breath, keeping an eye out for your colleagues and being there for them as much as hoping they'll be there for you.
Absolutely. And the key to kind of peer-to-peer support is incredibly important as well. I think being able to support your peers encourages an atmosphere of peer-to-peer support. And if anyone's going to understand your unique circumstances, it is your peers.
Yeah.
It is your colleagues. They are the ones that are best placed to support you where possible.
Yeah.
Yeah, with regards to that, and for those that do suffer in silence or even suffer out loud, in terms of supporting them, we can always feel quite helpless seeing someone go through that. What advice do you give those people that are looking from the outside in on someone that is finding a few challenges, whether it be in the workplace or with their studies?
Yeah. Look, one of the things that I think is important to mention is when a student does an undergraduate medical degree, the course content in which they cover around mental illness and mental health or psychiatry or psychology, it's very limited. So often we have students that become junior doctors that are incredible in terms of their skill set from a medical biological perspective, but often their psychological skill set around how to approach conversations, how to identify people that are struggling, and how to have those what can be seen as tricky or awkward conversations, it is something that often they struggle with. Now, you know, they are not alone. The bulk of our community often struggle with those conversations. So often they can recognize a friend or a family member or a colleague or a peer that they think is struggling. They've seen some changes in their behavior or their personality. They've seen them start to withdraw, but they don't know how to have the conversation. And often there's a fear. If I do have the conversation or if I raise it, am I going to make it worse? And what if I ask the question, are you okay? And the answer is no. What do I do? What do I say? So that in itself can be really anxiety provoking. There are some really great things like psychological first aid and accidental counsellor. They are both really short online virtual courses that anyone in our community can do. And I would strongly encourage, particularly our medical profession, to do. And it is around identifying how to respond, how to have those tricky conversations, how to ask the questions, and what to say if, in fact, the person actually says, no, I'm not okay and I'm not coping. Because the fear is, well, what do I say then? And will I make it worse? Well, the reality is, in the right setting, with the right kind of conversation pieces and a sense of confidence around not being able to fix the problem, but support them in actually accessing the help they need, and that sense of support around that process is incredibly important, and those conversations often are the key to actually getting someone to reach out for support.
Yeah, as tough as those conversations are, they are good to have, and it's good to know that there are resources where you can refer them to get that additional help.
Absolutely.
Yeah, fantastic. All right, well, it's been great to speak to you today, Luke. Thank you so much for providing some really beneficial insights into how we can all be looking out for our own and each other's mental health. It's so promising to know that there are increasing numbers of resources in place to help support those who need it. And I guess hopefully by having discussions like this, the walls of stigma surrounding mental health can be broken down. Guys, if you're a doctor out there or a medical student and you are struggling with your mental health, you can access free and confidential telehealth services through Doctors for Doctors on 1300 374 377, or as Luke had mentioned, Lifeline on 13 11 14. And, if you need some financial assistance along the way, Pete, what would be the steps that you'd recommend they take?
We do have some facilities that are tailor-made for students and so forth, so feel free to get in touch and we can go through your options.
So Luke and Pete, thank you so much for joining us here today.
Not a problem.
Thanks a lot for that.
Thanks so much, guys. Good on you.
Cheers, mate. Take care.
Thanks heaps, Luke.
Bye.
See you later.
Bye.
Bye.
For more information on finance and banking solutions for students and graduates, please call 1300 131141 or visit boqspecialist.com.au/students. This podcast is for general information purposes only and not intended as financial or professional advice. It has been prepared without reference to the circumstances of any particular person or business and should not be relied on as such. You should seek your own independent financial, legal and taxation advice before making any decisions. The views expressed in this podcast are those of the speakers alone and do not represent the views or opinions of BOQ Specialist.